Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah, Manager Workforce Development from Kaleida Health. Before I tell you who Kaleida Health is, just let me give you a little recap of who our guests for this morning. Our first guest we're having is Shannon Bryant, who is the Chief Diversity and Inclusion Officer at Kaleida Health. That's our first half hour. And our second half hour, we have Adrian Mudd. And Adrian is part of Human Resources, responsible for hiring, interviewing, job placement. So that's the second part of our show. But let me continue on. Welcome to the Great Lakes Health Radio program. And thank you for listening to this wonderful program on Power 96.5 FM, 1080 AM WAFO. And I just want to say, who is Kaleida? I know I say this all the time. However, people are still asking me that question in the community. Kaleida, we are hospitals. We're Buffalo General Medical Center, Oshai Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban Hospital, Visiting Nursing Association that provides medical care, clinical care in your home, 24 hours a day, 7 days a week, regardless of how young or how old you are. We're Great Lakes Cancer Care Collaborative. We are a full-service cancer hospital, clinics. We provide all of the services that a person, your loved one diagnosed with cancer would need, and the family members that support. Also, we have clinics located throughout the city of Buffalo. We also have them north of the city in the suburbs, south of the city in the suburbs. We have 2 long-term care facilities. That's High Point. High Point is at the corner of High Point in Michigan, where they provide full service rehabilitation as well as long-term care. And in Niagara County, we have DeGraff Memorial long-term care. And we also have a ambulatory and emergency standalone service also on the property and the campus of DeGraff. Well, if you have any questions about Kaleida Health, either doing job fairs, participating with you and your organization during a job fair, or even wellness fair, please, the easiest way, I'm going to give you 2 numbers, 716-863-8717. Again, that's 716-863-8717, or send me an email at F as in Francesca, Messiah, MESIAH at Kaleida Health, KALEIDAHEALTH.org. And also don't forget to check our website for jobs at Kaleida. Well, on with our show. Good morning, Shannon. How are you?
Good morning, Francesca. Thank you for having me on the show. I'm doing well.
Oh, you're welcome. And for our listeners, Shannon is not new to the program nor new to Kaleida Health. I think this is at least our 3rd time we've talked about the initiatives through Kaleida and our diversity, equity, and inclusion department. So on that note, Shannon is the Chief Diversity and Inclusion Officer. Wanted to make sure I mentioned that again. And Shannon, could you just give us an overview? When did Kaleida Health establish the DEI department? And why is it important?
I'd love to. The Diversity, Equity, and Inclusion Department at Kaleida Health was established in 2020. So there was a lot going on at the time, the pandemic, the racial reckoning, and throughout the United States and really globally. We had a lot of different reasons to establish the department. And I think the reasons why diversity, equity, and inclusion are important to healthcare are because we care for all people, different backgrounds, different walks of life, and that certainly impacts someone's health. So for us, it's very important that we're able to culturally understand the patients that we serve. And then also the people who work here. So our workforce continues to change, it continues to grow. If we are to really achieve and actualize our mission, having a good understanding of diversity, equity, and inclusion is going to be critical to that.
And I just want to say, mention, I just want to go back to what you said before. We care for all people. Could you just make sure what everyone knows, like when we say all people, we really mean all people, and all people meaning, go ahead.
Yes, that's a good question. So in terms of diversity, sometimes people will hear the word diversity and think it's really about race and ethnicity, and that is true. It does include that, or they might think about the LGBTQ plus community, and that is also a part of diversity. But it also extends to things like national origin, language, socioeconomic status, education levels, things, religious and spiritual affiliation, all of those things, age, gender, all of that is included in our diversity when we talk about we serve all people. It really is all different walks of life. And a lot of times we see those diversity identifiers who have been traditionally marginalized or disenfranchised throughout the United States have worse health outcomes. So that's why there is a heavy focus on race and ethnicity, LGBTQ plus status. We even look at things like veteran status, particularly as it relates to how they get their health care, paying attention to, different national statuses also, and how they're able to navigate the healthcare system, which can be quite complex.
It is. Well, since 2020, how has the DEI department at Kaleida Health evolved?
It's evolved in a lot of ways. When we started, it was really about focusing internally because there had not been a diversity, equity, and inclusion strategic plan or department prior to my arrival. It was important that we really level set what does diversity, equity, and inclusion mean for Kaleida Health. And so I already spoke a little bit about diversity. Inclusion is really the idea that you have that belonging feeling, that you feel included, and that your voice brings value so that it's not just, I feel good about coming to work, but also what you contribute to work actually matters to the value of the organization. And then finally, equity really means that we're providing a level playing field for all who receive care. So we started internally with talking about those terms and really providing education. Starting our employee resource groups was a big part of that. So hearing from the workforce about what is important to them as far as diversity, equity, and inclusion goals. And then making sure that internally we had a good, solid understanding and foundation. And then we've started to see in the last several years, we've moved more into looking at our data, looking at the patient side of things, and looking more externally to the patients that we're serving to say, how are these DE&I efforts really impacting health equity? So we have kind of two wings of the department, one that is focused more on workforce and, everyone who works here, making sure it's an inclusive and safe environment. And then another wing of our department is really focused on the patient aspect of things. So making sure that our efforts are actually making an impact for the patients that we serve.
Okay. Well, I'm going to step back for a second and let's focus on an ERG. We really haven't talked much about that, but can you please let our listeners know what is the ERG? And then also, how does it impact the daily activities of our over 10,000 employees that we have here at Kaleida Health?
Absolutely. So an ERG stands for Employee Resource Group. In other organizations, you may hear them referred to as BRGs, Business Resource Groups. or another kind of collection of employees. So this is really workforce specific. It's about everyone who works here coming together around a shared identity. So we have four groups at Kaleida Health. One is based on race and ethnicity, where we have a lot of people who come together to support different racial and ethnic services, whether it's for our patients or employees. They recognize and celebrate holidays. They talk about things like the social determinants as it relates to the race and ethnic groups that we serve. And then another group that we have is the parents and caregivers group. So that group comes together to talk about people who are in the workforce and who are also parents or caregivers. So a lot of people find themselves in like the sandwich generation, you'll hear it referred to, where you still have children that you're taking care of, but you also may have older adults in your life that you care for, whether it be parents, relatives, loved ones. And so really working with that unique group around how do they get value and benefit from the workforce. We have amazing benefits here that are available to our employees. So they focus a lot around how to make sure that they're taking those benefits that are already available to them and keeping them in the workforce, but providing that flexibility also. So then we also have a group called SAGE, which stands for Sexual and Gender Equity. So that's where we'll see like people come together around the LGBTQ plus community. And so they work on things around data as it relates to identifying, self-identifying in the workforce, but also self-identifying as patients using pronouns, reasons why that's important for patient care and for respectability. So that group works there. And then we have our final group, which are the Veterans Engaged Together group. And that's made up of veterans who are either active duty, have past served, or it could be family members of veterans. So we have a lot of people in that group who they themselves may have not served, but a loved one has, whether it be a spouse or a relative. And the goal of that is to make sure that we're not only making it easy for our patients to navigate the healthcare system, but also employees, and making sure that we're understanding the skills that veterans bring and how that really can apply to healthcare today. So each of those groups get together on a monthly basis and they work on different initiatives. And the goal is to improve both the workforce as well as the patients being served in each of those areas. Of course, there are many more groups that we'd like to start. But it's important for us to, we're kind of a small but mighty team. So trying to do the most that we can in those areas has been where we prioritize. And I do think in the future, I would foresee those groups growing. I know there's been buzz about wanting to have a group for different abilities and neurodivergent. And we've also talked about wanting to have a group of environmentalists, so people who are really invested in recycling and taking care of our campuses.
Mm-hmm. Yeah, and I just want to mention for our listeners that when Shannon first began in this position, she was one. And how many are part of the DE&I staff now?
So we have a team of 6 now, which is
Six, yeah.
really exciting to see. Yeah, it's grown very quickly, but I think appropriately for the needs of the
purposefully, yes. And
Mhm.
and I know that I'm a member of the race debt group, and right now we're in the process of planning for our employees because we always have to make sure we take care of our home, as well as the community, but we have to make sure that we're looking out for our home. And we do have a Juneteenth program coming up. For here at definitely at Buffalo General and the sites. And I know I just saw an email talking about volunteers for the Pride Day parade. And we always do something for around Veterans Day, where we include our employees at the long-term, our employees and residents at our long-term facilities. So I just want you to understand that it's large. It's grown. The department, the activities, the inclusivity, everything has grown since 2020. Shannon, what's on the horizon for the Diversity, Equity, and Inclusion Department at Kaleida?
Oh, Francesca, so many things. I just wanted to also thank you for your time that you volunteer and give up to support the DE&I efforts throughout Kaleida Health. It really does mean a lot, and I know you're very invested in those efforts. So we're just glad that you're a part of the team.
Oh, thank you.
Of course. So, what's on the horizon? So, I think I started to talk a little bit about how we're looking externally and how we can really impact not only the employees, but really starting to look at our patient stuff. So, we've been embarking on what's called a social determinants of health
If
tool.
you could just
So,
let our listeners know a little bit why is that important, the social determinants of health?
yeah, so the social determinants of health, these are things um, that impact our health, but are not directly something that you would see in a healthcare setting. So we want to think about things like transportation, housing instability, food instability, utility needs, social supports, personal safety. So those things impact health, even though they don't really have a direct health diagnosis, but research has shown that they actually have a greater impact on our health than diagnosis can have. So we want to start to look at those. We have some regulatory governing bodies, such as the Center for Medicaid Services, as well as other governing bodies that would like us to look at those things. And for us, it has always been something that we've unofficially done. So now what we're trying to do is use a tool to make sure that we track all of that. As far as looking at someone's transportation or social supports or nutrition, because we know it impacts their health. So even though we can't handle it in the acute care setting, like if someone's in the hospital, we may not have the ability to place them in a home. But what we can do is we can connect them with community supports that would allow them to be placed into a home and then follow up with that community support. That might be in the form of a care manager, a care coordinator, you might hear it called. And so that's really been a big project for the whole system, especially in the inpatient hospital units. So having that tool built into our electronic medical records so that doctors and physicians, they're aware of what those social needs that people have are, and then they're ensuring that they connect them with the social work department, which will further connect them with those outside community resources. So that's one of the big things that we're working on. Another big thing, and I think we may have talked about this in the past, is SOGI. You'll hear it referred to, but that stands for Sexual Orientation and Gender Identity Data. And so what we're trying to do with that project is ensure that people are able to have their correct pronouns and things noted in their electronic medical record, as well as on their wristbands or any labels. So for instance, if I'm coming into the healthcare system and I use she, her pronouns, I would want that to be noted in my chart so that everyone is referring to me as she or her. It can be very damaging to folks who their outside appearance may not may not be able to tell you anything about the pronouns that they identify as. So just because outwardly I may dress more feminine, I may do more feminine activities, does not necessarily mean that I want to be called she, her. So it's important that we get that information from our patients and that our physicians and our clinical teams, even our transportation teams, are not assuming someone's gender identity based off of their outward appearance, because that can really communicate disrespect. It can communicate that we don't care. And of course, that's not the case. So for us, this project has also been very critical to making sure we're able to serve the LGBTQ plus population and really all populations, right? Another big project has been around expanding our patient demographic captures. So right now, there are certain ways that you can identify with race and ethnicity, but we know that it doesn't always capture everyone's racial or ethnic background. So what that means is we want to make sure our drop downs are a little bit more inclusive and able to really capture the diversity that someone has. For
And drop
instance,
downs and drop downs meaning the drop downs on forms and documents.
yes, yes,
Okay.
yes. So that patients can actually tell us what their race and ethnicity is and self-identify that way. That is something that people find it's sort of like the pronoun conversation we had. It's important that people are able to identify their ethnic and racial background with their healthcare providers.
No, it really is. And also, and besides that, I also add so that our employees are trained. It's not just what Shannon is saying, but there are trainings all employees are required to take that align with everything Shannon is talking about. So in terms of your question, listener might think, okay, well, this sounds good, but how are our employees educated? And could you just talk a little bit about what you've been talking about, the social determinants of health and SAGE and just different things? How are our employees internally? What types of trainings do we have to go? Is it required that we go through?
Mm-hmm. Yeah, those are great questions, and there's lots of training out there, and lots more that will come. So most of our training we do in talent management, which is our learning management system. So that's really just code for electronically. But we also do a good amount of our training in a more scenario-based format. So making
What's
sure
that?
that
What's scenario based? What does that mean?
making sure that we have sort of an example of how someone's day would go. We like to give a little bit of a story and then ask a group of people to pick out, why would the social determinants of health impact this patient? So of course we're making up fake stories, but it's to stimulate thinking and to get people really brainstorming about how the social determinants of health work, or SOGI with the sexual orientation and gender identity. And this form of learning really helps because with adult learners, we know that we like to problem solve. And
Right.
we have the answers a lot of times already, but it's just talking those things through in a group setting and then hearing what other people come up with usually builds on the education.
Mm-hmm. And sometimes adult learners feel that they don't have to learn anymore because they're adults. But we
Sure.
just want to make sure at Kaleida that our employees are treating our customers. Our customers are our patients in the hospital. Our customers are our friends in the community. We just want to make sure, and Shannon is doing a great job at leading this through trainings. They're electronic. All employees have access to them. All employees. So I just again want to reinforce the things that we're doing. Shannon, I'm sorry. We do have a few minutes, and I think I didn't mean to interrupt you about the what's on the horizon.
No, the last thing that I would mention that I think we've also talked about in the past is around
Mm-hmm.
birth equity. So
Yes.
birth equity, if you had to define it, it's the assurance of the conditions of optimal birth for all people with a willingness to address racial and social inequities. So, really, what that's saying is we know from research that Black and Brown women are 3 to 4 times more likely to die during childbirth than their white counterparts. And that is a statistic that we are working to change. Some of the reasons why, lots of research, especially in New York State, has been done around this. Some of the reasons why really lie with the relationship that Black and Brown patients have with their physicians, and sometimes not being believed during the interaction around their pain Sometimes Black and Brown people are seen to experience pain at a greater rate than their white counterparts, which is a total myth. But because some of those myths and biases exist, this can lead to really negative outcomes for our patients. So what we do as far as that, we've started a maternal advisory board. This board is made up of people who are either delivering at Oshai or Suburban or Olean or looking to deliver at one of our sites in the future. So, maybe they're at Chow, looking to find a provider to deliver at. We want to bring them in and really share with them some of our processes and let them share with us some of their interactions or experiences with us that we might be able to improve upon. And what we found is, a lot of times it comes down to communication. It comes down to slowing down and really getting to know the patient and getting to know their family structure and not making assumptions or judgments. And a lot of it also has to do with cultural appropriateness. So different cultures, have labor and delivery go different ways, and there's different considerations and safety reasons that need to be considered during that critical, vulnerable time. So we really tried to look at all of those things and gather that information to bring back to our physician teams and further educate them. I'm sorry, what were you going to say?
I was just going to say, only because I know the program's almost over. I'm just sad we're doing the birth equity last. Do we have enough content for birth equity for a half hour?
No, I think that's plenty. That's kind of
Okay.
what I would say as far as, the lead way that we've been making.
Let me know when you're ready for birth equity, because I would like to spend an entire half hour or 28 minutes discussing birth equity and the importance of Black and brown moms dying in birth and babies dying and not doing well during birth. So that's just a whole nother topic that I'll be asking you about like every month. Are you ready to come back and talk
Oh
about it?
no. No, that
Our
will be
offices are
really
right
good.
around the corner.
That'll be really good. I look
Oh,
forward to it. I look
oh,
forward.
good. Well, Shannon, we only have a minute left. So, what would you like the listeners to know about DEI?
I think at this time where we're at a critical time with diversity, equity, and inclusion, we're seeing, some places are backing down from those commitments. I think it's important for the listeners to know that they have to stay committed to these efforts. It is not something to be taken lightly, especially in healthcare, where it really is about our bottom line is to advance the health of our community. And the only way we can do that is if we know our community and then we're serving and meeting their needs to the best of our ability. So we have to continue to work to do that.
Well, thank you. And on that note, I want to thank Shannon Bryant, Chief Diversity and Inclusion Officer at Kaleida Health, for being our guest this morning on the Great Lakes Health radio program. Thank you. Thank you, Shannon.
Thank you. Thank you so much for having me.
You're welcome. In our next program, we will be talking about birth equity.
Wonderful.
Oh, great. And listeners, go grab a cup of coffee, heat your coffee up, because in a couple minutes, and not in a couple of minutes, but from 7:30 till 8, our guest is Adrienne Mudd, talking about employment opportunities throughout the Kaleida system. Thank you, listeners. Thank you for joining us the first half hour here on the Great Lakes Health Radio program with your host, Francesca Messiah, Manager, Workforce Development. And now on to part 2. I hope you enjoyed part 1, where we talked about our diversity, equity, and inclusion initiatives here at Kaleida Health. And welcome to part 2. And thank you for tuning in. Well, what is something that we hear people talk about often? Something we hear often. Jobs. Are you happy with your job? Do you like your job? Or do you want to are you interested in the career? Do you want to change careers? Anything around How do I get my child into a job? How do I start a career? I went to school for this. Well, today's program, we have with us, our guest is Adrian Mudd. Good morning, Adrian. How are you?
Good morning, friend. I'm great. And you?
Good. I'm very well. And Adrian I'm going to give you your title, and your title is Senior Talent Acquisition Partner for the Visiting Nursing Association of Western New York and Kaleida Health Labs. And I just want to tell our listeners our topic for the second half of the program is workforce careers and recruitment at Kaleida Health. And on that note, Adrian, I'm going to say, could you please tell our listeners what is a senior talent acquisition partner? What does that mean? What do you do?
Sure, absolutely. It's another way of saying a recruiter. I recruit folks to work at both the Visiting Nursing Association and the Kaleida Health Laboratories. And as time goes on and we evolve, the position of a recruiter kind of evolved as well. So, at this stage of the game, my goal is to be a partner or even an advisor to our folks that are applying for jobs, and then also the managers who are hiring the folks for the jobs.
So then you would have conversations sometimes with the managers about what they're looking for. I mean, just an example. Is that what you mean?
Yes, it is.
Okay. So, and I should have asked the next question. Do you work with a team or do you work alone?
Yeah, so I am part of a team. Myself, I'm positioned at the Visiting Nursing Association. However, our team is spread across multiple sites. There is the nurse recruitment team over at the hospitals, and then there are the corporate recruitment team who are positioned at various locations, and I'm part of that team. There's about 10 of us total.
So the nursing is separate team is separate from non-nursing. Is that what you're saying?
Yep, that's correct.
Okay. All righty. All right. That's good. What are the age requirements for working at Kaleida? I get that question a lot in the community, and sometimes I get that question from Kaleida colleagues.
Sure. So at this point, there is a requirement of being at least 18 years old to work for Kaleida Health.
Mm-hmm. So then how would one apply for a job? Now we're getting this conversation, we're getting into the nuts and bolts of the whole job process. So what's the first step in applying for a job? Someone's listening to the show right now. They said, oh man, I've always wanted to work for Kaleida. What do I do? How do I get started? So what's the first thing?
Sure. So all of our positions are posted online at kaleidahealth.org/careers. And when they get to that site, they can filter it down by location. So they can filter down by Millard Fillmore Suburban Hospital or Buffalo General Hospital or the Visiting Nursing Association. And then they can also enter keywords to search for various positions, or they can review all of them to see what would best meet what they're looking for.
Mm-hmm. Mm-hmm. Yeah, and I know that. So when you go on the site, can you put in like the where you want to work? Because I just want to say, because this is the second half of the show, and if you're just now tuning in, Kaleida Health, the locations are, and I'll let you fill in the rest. Buffalo General Medical Center, Oshai Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban, the Visiting Nursing Association. Are there Olean Hospital? Are there any other sites that I missed?
Yeah, there is, like you said, there's Olean, there's Brooks out in the Dunkirk Fredonia area. There is Bradford in Bradford, Pennsylvania, and then there is also the Flint Road Laboratory, which is located in Amherst, Williamsville, by the Buffalo Marriott.
Mm-hmm. Oh, and our long-term, could you tell us the long-term care facilities?
Absolutely. There is High Point, which is on Michigan Street near Buffalo General, and then DeGraff behind DeGraff Medical Park in North Tonawanda.
Okay. So as you can see, when you go on the website, so I guess I'm going back to my question. Can someone just, for instance, type in Buffalo General Hospital and the positions would then appear that are open?
Yes, they can absolutely do that.
Mm-hmm. Is there a preferred way of how to search for a job, or a way that you recommend as first steps when you're looking at the website?
Sure, that would depend on kind of where you are in your career search. If you're someone who is looking to see what positions are out there in general, then I would, definitely choose a location that's maybe closer to home just to see what's out there. Whereas if you're someone who, if you know exactly what you're looking for example, if you're looking to be a radiologic technologist, which is like an X-ray technician, they can put in that verbiage as well, and it would show them the openings at all of the locations. So they can kind of go about it either way, whatever works best for their needs.
How about if someone wants to be, they're looking at it, a senior level or a managerial position, vice president? Would they type that in? What would they type in if they're looking, if they're searching, if they, let's say they have undergrad and one or two masters, or undergrad and they're just graduating in the spring with an MBA? What would they type in something different?
They could type in manager, or they could type in director, or they could also put in Larkin at Exchange, which is where our corporate office is located.
Okay. Okay. Next, I get a lot of questions. How important is it to attach your resume to an application?
Sure. So our application system does not require a resume to be attached. However, it's kind of one of those things where, the more information you can put out there about yourself that supports the position for which you're applying is definitely helpful. So, with that said, I would encourage everyone that has a resume to attach one, but it's not required.
Mm-hmm. Now, for someone who isn't necessarily computer literate, um, and is it an easy step? Like, what can you, like, offhand, like, what is it that you have? Is it simple to attach your resume, or there are a few steps that you have to go through? Can you share?
Sure. So while someone is applying for a position on the Kaleida Health website, while they're doing the application, it's actually going to prompt them and ask them if they would like to attach a resume, and they can just click yes and then follow the prompts from there.
Mm-hmm. Okay. Now, let's say you see two jobs that you like. Well, let's say you see three because you're really excited, and you have all the, this person has all these skill sets. They see three jobs. Um, do they apply for them separately? And if they're applying for them separately, do they have to then attach their resume separately for each position they're applying for?
Great question. Thank you. So, the short answer is, if you see multiple positions which you're interested in, absolutely apply for all of them. But going back to your question, the first time you ever apply with us, you're actually creating a profile and answering a number of questions and attaching your resume. But once you've done that, you only have to do that one time. So once you've done that, you're actually able to apply for additional positions with just a few mouse clicks.
Mm-hmm. Also, on a resume, because I know that I've done, writing a resume. I've walked people through that a few times. However, you're the expert. Um, how about dates? How about people putting age on there? And I know that there's, like, there, you can't discriminate against age, but I've noticed some resumes, or some people still like to put their age and all the different years that they worked at different, if they're seasoned in the workforce. What are your thoughts about someone who's applying at age 22? And what are your thoughts about someone applying for a job when it comes to age and dates where they've been, if they're 42? Is there a difference?
Sure. So I wouldn't say that there's much a difference in age versus there is a difference in, maybe work history. So, when you're at the age of 22 and you're kind of starting out, you would probably list any and all work experience that you have and also your educational experience. Whereas when you are a little bit further into the workforce, at that point, when you're applying for positions, your resume should probably be more suited for the position for which you're applying. For example, if you're applying to Kaleida Health and you've worked in the healthcare industry maybe for a while at other companies, you'd want to list the experience that's relevant to Kaleida Health as opposed to maybe a job that you had when you were, in college working at a restaurant or an amusement park, wherever the case may be. So kind of as your career progresses, tailoring your resume to go along with that. As far as your question regarding putting your age on a resume, that's not necessary.
Okay. I mean, yeah. Okay. So putting an age on a resume, listeners, is not necessary, because we know age discrimination does exist, and it's not. And bottom line, it's not necessary. It's not required by law. So I just want to make sure that our listeners are aware of that. How important is it to then to include your experience that ties in with the job?
It's very important. Any experience that you can showcase that is relevant to where you're applying, definitely include that.
Mm-hmm. Now, can someone just come to, let's say, the human resource office at Buffalo General and just drop off a resume? I mean, a lot of places are no longer doing that. I mean, a lot of small businesses, large businesses, you can no longer, like years ago, drop off a resume. How about at Kaleida?
Sure. So, every position does have to be applied for online, so they would not be able to just drop off a resume. However, we are actually getting a computer set up for folks to apply for positions outside of the Human Resources Department at Buffalo General.
Oh, good. Oh, good. Yeah. So listeners, hopefully within the very near future, if your computer isn't working at home, if you just don't have internet at home, you'll be able to come into the Human Resources office, but you'll have to stop in at the first floor like you're visiting somebody, and then you'll say the Human Resources office. And hopefully within the next few weeks, we will have at least one computer ready for you to use to begin your job search and further your career at Kaleida. How many times? Let's say again, this is a question I frequently receive in the community. How many times should you apply? Can you apply for a job? So you've applied for a job, you haven't heard anything back for, let's say, a month. Should you reapply for that position or reapply for another position? What should one do?
Sure. So the system will actually only allow you to apply for each position one time. However, applying for additional positions is certainly a good option. And the reason that I say that is every position that you'll see posted is one person, one shift. So one example would be dietary at Buffalo General, full-time second shift, whereas you might see another one that says dietary Buffalo General, part-time third shift. So you'll see multiple postings with the same title because each one is literally one person. So with that said, if you see multiple, I would definitely encourage applying for additional positions.
Okay. So it's not the same position. That's what we're saying.
That's correct.
Mm-hmm. Okay. Also, can you share with the listeners, because because we're talking about clinical and non-clinical positions, correct?
That's correct.
Okay. And something that I just read about yesterday, it said on the our internal communications here at Kaleida, it said paid summer home health nurse internship program. Could you talk a little about if you're applying for a nursing career? Is that something you look at nursing? But if you could just talk about what is the paid summer home health nurse internship program? Do you have information on that?
Absolutely. So that is through the Visiting Nursing Association, the VNA of Western New York. And that's a great opportunity for a nursing student who's going into their senior year to be able to partner with a home health nurse through the VNA and go out with them and shadow them and see the cases that they manage throughout the summer. And then as the summer comes to a close and they're getting ready to go back to school, if they would like to stay with us, they have the option of completing a 4-hour class to become a home health aide, which would be a position which they could have until they graduate from nursing school and get a nursing position.
So if they're in their, so is it only for 4-year institutions, or is it for some of the nursing programs that are 2 years?
It's absolutely available for 2-year and 4-year students.
Oh, wonderful. So they would, and how would they apply for that?
Sure. So that would be on the VNA's website, which is vnawny.org. And they will, underneath a column or a heading that says events, they'll see that posted there where they can apply for that.
Okay. And just so we know, VNA stands for Visiting Nursing Association, and it's they provide home health care 24 hours a day, 7 days a week to residents in the 8 counties. Is that what are the 8 counties of Western New York?
Yeah, that's absolutely trure.
Mm-hmm. Okay. And again, it's called the Paid Summer Home Health Nurse Internship Program. And I'm assuming if you would successfully complete it, then you said you applied to Kaleida Health and for a full-time job or part-time job in nursing.
Either one, whichever they would like to do, we can help them try to get there.
Okay, so in terms of that's an internship program. So please share that with your loved ones, or if you're interested. And remember, nursing is male and female. Just so it's just so we know that. I'm always asking colleagues or people in the community, what's a question for the radio program? And I asked a colleague, and one of the things that they said was they would if they were listening to this program, they would like to know what would make them stand out. What makes an application stand out from another application? They said that would be something, if they were listening, that they would like to hear more about. So I'm asking that question of you, Adrian.
Sure. So with that, sometimes it's the small things, and so simple as, filling out all of the fields on the application and using proper grammar and punctuation. And like I said before, showcasing your experience that's relevant toward the position. If you're not attaching a resume, that's okay. Like we talked about earlier, when you're filling out the application, there are areas where you can enter all of your relevant experience. So if you're not entering a resume, or if you're not attaching a resume, I would encourage everyone to fill out those fields, accurately and completely to showcase their experience.
So that would be something that you would say would be something that you would definitely encourage, to make sure you've completed that you've completed the fields. How about if you're completing those fields, do you encourage abbreviations, or do you encourage things to be spelled out?
I would encourage things to be spelled out. Just that way, whoever's reviewing the application, so that they don't overlook anything.
Mm-hmm. Mm-hmm. Yeah. And again, and the reason for asking that question, listeners, is because many times we get used to communicating in text message. And where, you put thank and you put a you, or you put whatever the text is. There's a question. should you fill out an application like you're sending a text message?
I would say absolutely not. Make sure everything is filled out completely.
Mm-hmm. Mm-hmm. Okay. Alrighty. Yeah, because a lot of times people will do that. How about just simple things like an email address? I know some people have email addresses that will have mild vulgarity. What do people, I mean, and again, I know we're not supposed to be judgmental or anything, but what would you recommend for someone who's been using this for the past 15, 20 years, since they've been 10 years old, and it's worked for them all these years? What would you say to someone about that, as well as changing possibly a welcome on their phone? How do you feel as a senior talent acquisition partner? Any tips on that?
Sure. So, me personally, I have a second email address that I use only for the purpose of when I am setting up professional communications. So I would use that one. So with that said, email addresses are typically available. So, there's no reason that you shouldn't be able to get a second one to use in addition to one that you already have. So if you get a new email address, you could use that when you're applying for positions. And then as far as your question on the cell phone, same thing. You should be able to edit the signature, make sure that it contains your contact information.
Mm-hmm. Yes, please. Do that. And I know these are the types of things, even when speaking with younger people, high school students, this is the same information, but it applies across the board. So I just want to make sure that our listeners are aware of that. What are some things that you would you've been doing this for, in this field for a while? What are some of, let's call them Adrian's favorite tips? What are some of your favorite tips, Adrian? If someone were to say, okay, these are my observations, these are my favorite tips on getting a position.
Sure. So, in addition to what we've already talked about as far as completing the application, when it comes to interviewing, making sure that arriving for the interview at least on time, but preferably 5 to 10 minutes early. That way, you can get yourself signed in and situated and start the interview right on time. And, dressing appropriately for the interview, and, making sure that it's a thoughtful conversation. Make sure that your cell phone is on silent or powered off while you're in the interview, so that you are not easily distracted the way that I am. And with all that said, following the interview, I recommend sending a thank you, and then kind of going from there.
Dressing appropriately. That's because dressing appropriately years ago, it was standard. But now, and I always use the example of, you see these, stars on television and red carpet, and people think, oh, what does dressing appropriate mean?
Sure. So, you're absolutely right. Times have changed. A three-piece suit is certainly not required. However, I would recommend business casual at a minimum, which would be, for men, khakis or slacks, along with either a polo shirt or a button-down shirt. A tie would probably not be required. And then, for women, either, very similar, or like a suit.
Mm-hmm. Yeah, and I just also want our listeners, recently I had I met with people at the over at the Salvation Army, and their thrift store, and any of the it was a Goodwill, sorry, but any of the thrift stores. It doesn't matter if it's a thrift store on Elmwood, if it's a thrift store, Goodwill, Salvation Army. Everyone has the kind of interview clothing we're talking about. Men or women, it can be khakis, it can be dark slacks, men or women, a nice shirt, a shirt that fits, something that fits you well. And if you want a jacket to go over that. And I personally go in and out of the stores. I personally shop at thrift stores, and thrift stores have that as well as shoes. Um, they have everything if you're going for an interview. Also, I want to add, I know, Adrian, you said 5 to 10 minutes early. I just want to mention that our hospitals are large. And to get to where your site is, it doesn't matter if it's Buffalo General, Oshai, or Suburban. Sometimes you have to wait online for someone who's looking for, getting a pass for a patient. So I would say at least give yourself a minimum of 15 minutes between parking, and you might be fifth or sixth online, and then getting to the site. So because all of our hospitals are large, and there's always a short walk. And if you can't walk to that, please ask for a wheelchair at at the hospital, and we do have wheelchairs in case you're in need of a wheelchair, because we hire everybody, right, Adrian?
Absolutely.
So if you need a wheelchair for your interview to get to where you need, don't be afraid to ask for one. And on that note, Adrian, what is our website? We didn't have it. Can you just quickly let us know how someone would go to the website?
Sure. There's kaleidahealth.org/careers or vnawny.org/careers.
And positions are full-time as well as part-time?
We have full-time, we have part-time, and we even have per diem, which is a minimum of 3 shifts in a 4-week period.
Thank you. And Adrian, on that note, we are out of time, but I want to thank you, Adrian Mudd, who is our Senior Talent Acquisition Partner, Visiting Nurses of Western New York and Kaleida Health Laboratories. I want to thank you for being our guest this morning on the Great Lakes Health Radio program.
Thank you so much for having me. I really appreciate it.
Oh, you're welcome. And next week, you'll hear from my esteemed colleague, Cindy Bass from ECMC. And God be willing, in 2 weeks, you'll hear from me, Francesca Messiah, Kaleida Health, Manager Workforce Development. And take care, and thank you for listening to the Great Lakes Health Radio program. Bye-bye.